This is One on One. We're pleased to welcome Marjorie Paloma, who is Senior Director, Robert Wood Johnson Foundation, a really special organization based in Princeton, New Jersey, right?
That's right.
And by the way, the Robert Wood Johnson Foundation is a significant supporter of public broadcasting, more specifically the Caucus Educational Corporation, a lot of our health-related programming. There's an initiative that we know about that I want you to share with others called the Culture of Health. What is it, and why does it matter to everyone watching right now?
That's right. So a culture of health. Our work at the Robert Wood Johnson Foundation is really to look at and ensure that every person, no matter where they live, what they look like, how much money that they make, that they have the best opportunity to live a satisfying and a healthy life. That is a culture of health.
Not easy.
No.
Because?
No. It's not easy because it takes not just those in health, but people in education, transportation, housing, business. It takes a nation to be able to get there. And if you think about the word culture at its very basic meaning, it is about what shapes your life. It's the kinds of things that you do in your life. And so when you think about health being not just in the doctor's office, but outside
That's right.
of the doctor's office, there are many, many players.
Let's break that down. By the way, the cities that, I shouldn't say the cities, the communities that culture of health is so prominent in, include, say what they are?
Sure. So our vision is actually across the entire nation. But because we were founded in New Jersey, we have a very special relationship with our home state of New Jersey. So we actually, we promote a culture of health across the entire state. We have a whole set of coalitions that are funded through our sister organization, the New Jersey Health Initiatives. There are 20 coalitions right now that are focused on building a culture of health. We also work with an organization called the Y State Alliance through the New Jersey Healthy Partnership. They initially were focused on 5 communities, so Newark, Vineland, Camden, Trenton, and New Brunswick. That's right. But that has since grown, and that tells you a little bit about the culture of health. That's right. So from 5 communities to now over 60 communities with over 200 policy and environmental changes that have happened.
Take a step back.
Sure.
You're talking about beyond clinical care, if you will. Are we talking about the kind of food, healthy food people can get access to, so-called food deserts? That's one piece, right?
That's right. That's exactly right.
That's not easy.
No, it's not. And that's where partners like the Community Food Bank of New Jersey come into play. Phenomenal organization. So if you think about New Jersey, we have over 1 million people hungry. The Community Food Bank is a grantee of Robert Wood Johnson Foundation. They serve over 900,000 people.
I should disclose we have a partnership with them to increase public awareness around food and security issues. I'm sorry, go ahead.
But what's so exciting about what they're doing is, they're at the front lines of hunger, addressing the needs. But they're also thinking about what are the kinds of things that people who need food, what else do they need? Is it about housing or transportation or financial support and filling out tax forms? And really helping people say, yes, hunger will meet those basic needs, but what are the other kinds of things that are going on in your life?
That's right. There's a Sesame Street connection?
Yes.
What is it?
So one of our partners is Sesame Street. So think back to your childhood and think about how Elmo or Big Bird shaped your own perspective.
Elmo's been on one-on-one checkout. You can see past interviews. Go ahead.
So with Sesame Street, we're looking at how can we work with them to support children, their families, providers, to really support kids, especially kids who are going through trauma. So if you think about things like divorce or neglect or even violence.
These are health issues.
These are health issues, and they have implications for kids' lives in their future. So when kids grow up, what we know is that kids who experience these adverse childhood experiences have higher rates of diabetes, higher rates of obesity, have challenges in school. And so we're working with Sesame Street to really provide tools like videos and blogs and games for kids and their families to provide the support that they need.
The question of poverty, people say, oh, it's an economic issue, which it absolutely is. It is an issue of health, correct?
It is. It is. So when you think about economics, what we know from kids who experience adverse child experiences, oftentimes those children are also coming from communities that are lower income. So when you think about where do we need to really zero in on, how do we build partnerships that help to support all kids, but especially the kids that don't have, kids and families that don't have those supports, that's critical.
Before I let you out of here, you were telling me that you came to the foundation, I guess, 2004?
That's right.
Where'd you grow up?
I grew up in Baltimore.
On a personal human level, I know a little bit about Baltimore. I grew up in Newark. They're not that much different. Only we have the Yankees up here and you have the other team, the Orioles, right?
We won't talk about that,
I should
Steve.
leave that alone. I'm sorry. That's not part of the agreement. There's no agreement. I'm just joking. But in all seriousness, because you grew up in Baltimore, a city that, like Newark and the cities you mentioned before, Trenton, Camden, and others, struggles. How much do you particularly appreciate the work that you do for the Robert Wood Johnson Foundation?
Well, so that goes to the heart of why I wake up in the morning. Everything that we do at the Robert Wood Johnson Foundation is really focused on building opportunity for people across this country. And when I wake up, I think about that mission, that vision, that really inspires me. I think about that. I think about the people that I get to work with, not just in the building at RWJF, but all of the people in New Jersey and across the nation that are making this work happen. And it just brings joy to me.
Well, I want to thank you.
Thank you
very much for joining us and sharing important information that matters to everyone watching right now. Marjorie Paloma, Senior Director, Robert Wood Johnson Foundation, I thank you so much.
Thank you so much.
We appreciate it. Stay with us. We'll be right back.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by the New Jersey Education Association, New Jersey Sharing Network, RWJ Barnabas Health, the Russell Berry Foundation, NJ Best, the New Jersey Office of the Insurance Fraud Prosecutor, and by Verizon. Promotional support provided by the New Jersey Business and Industry Association and by Jaffe Communications. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.